Right, good evening, Marion. Sorry, we're obviously running a bit late because we've had a fair number of technical issues this evening, so I'm going to shut up and let you get straight on with it.
Okay, good evening in lockdown land. Tonight we're talking about taping. It's all about taping. It's about taping infants, children, adults with SMA. It's about treating parents and carers. I'm a big fan of taping. I've done lots of taping courses. I'm really not a fan of badly done taping. That is, in SMA, two particular problems. One is no understanding of the mechanics of SMA, and the other one is no understanding of taping and what it's going to achieve. So there are three major schools of taping. There is sports taping, which is basically what you see on the television, on the marathon, on football matches, where you see people covered in tape. And many therapists do not like sports taping as it is used, because basically it is patching sportsmen or amateurs, patching them up, patching up their pain and their injury so they can go and re-injure themselves. It's really not useful. If you're injured, fine to be taped, but not taped so that you can just go and keep redoing the injury. But there are some really good sports taping techniques that work on everybody. I have done sports taping and I really think it's very effective in things like sprained ankles and injuries and pain, and it is worth learning. But the other two main schools are very similar: kinesio taping and therapeutic taping, very similar, a lot about muscle re-education, about correct placing of the tape to get a good result in terms of whatever you want to achieve. It doesn't work for everything, but it's all about having the tape going in the right direction, having the right amount of tape to get what you want, to try and get a result, to stimulate skin, to stimulate muscle underneath the skin, and to basically re-educate the muscle in different ways. There are a lot of other ways of using it. You can use it for pain and swelling, and I can show you a particular swelling tape which is very good, but there are swelling techniques which you can use for joint and ligament support, particularly in injuries, but in repetitive strain, for proprioceptive input, which is something about sensation and knowing where you are in space, and persistent posturing. That's not contractures. But if you have somebody who's sitting in a particular way or have their hand in a particular posture, and that is normal for them, we can try as part of re-education to improve that posturing, but you cannot use taping forever. You can't just think, oh, I'll put it on and I'll leave it on. Keep taping, keep taping, keep taping. The body adapts to it, it stops working. 3 to 4 weeks maximum. If it's working, stop and start again. If it's not working, just stop. So what we need to look at first is your kit. And there's a few things you need. And the biggest issue, of course, is the tapes. Now, I have many, many tapes because every time I see a different tape, I go and buy it and try it. And the two tapes that I use most are kinesio tape and a tape called Cure tape. And they're very similar. You won't see much of a difference except in color. There are a lot of different colored tapes. One of my amazing, amazing teachers, a lady called Esther DeRue, believes that the right color is for the right person. I'm not 100% convinced, but there's lots of pretty colors: orange, blue, blacks, all sorts of colors. You can have rainbow, you can have animals, all sorts of tapes, but you need to be sensible about the tapes you buy. Firstly, there is an issue with color. Bright, happy pink. The only time I have had any allergic reactions to tape is with pink. There are good tapes and bad tapes. There are some really cheap and nasty tapes, and what you will be allergic to is the glue. And a lot of Chinese tapes. And I say Chinese specifically because Japanese tapes are excellent. Cheap Chinese tapes will have very poor glue that a lot of people can be allergic to. But even kinesio tape and Cure tape use vegetable dyes. And you would think that there wouldn't be a problem. But if people are asthmatic or if adults smoke, for some reason, the dyes used in pink tape are much more likely to cause an allergic reaction in asthmatics and smokers. And the only 2 times I have had any allergic reaction were both friends of mine who I taped for different reasons, and both were smokers at the time. Both have given up subsequently, but I don't use pink tape. So most tapes, good tapes, have one thing in common, apart from the fact that they have a similar stretch, and that is this sort of marking on the back of the tape. And the reason you have this marking, particularly the vertical lines, is so that you know what length of tape you used, so that you can say you use 2 sections or 3 sections or 4 sections, and you can reproduce it each time you tape. This is a tape I bought in Flying Tiger. It has no markings, so you have no real concept of what length of tape you used, and actually it's not a very good tape. It's not a bad tape, but it's certainly not the best of tapes. Now, the other thing that you need to know about tapes is if you cut them and look at them, there is something quite interesting about the tape. The backing paper, the tape is put onto the backing paper with a certain amount of stretch. So if you gently peel the tape off and put it back again, you will be left with a thin line that wasn't there when you started. And the reason that that happens is that the tape is applied to the backing paper with a stretch already on it. So even if you do not pull the tape, there is already a little bit of stretchiness there. So you need to be careful. There was a time when I first learned taping, when I heard about this 10% stretch, 20% stretch, and I wasn't convinced. But the more I taped, the more I realized that in a lot of cases, the amount of stretch is important. Now, the other thing that you will notice about the tape, if you hold it up to the light, and I'm afraid I can't really show you, you can see a little bit there. You can see that actually the tape has little striations that look like skin. And the important thing is the tape does not stretch in that direction. It only stretches in that direction. So you can't stretch it always. So be careful of the tapes you buy. There are hypoallergenic tapes for people who find they're allergic to a lot of sticky tapes. If you're allergic to elastoplast and glues generally, and you do think you're allergic to tapes, there are, and they're usually this very, very light pink, there are hypoallergenic tapes available. I am currently a fan of this tape. This is rock tape. Now, admittedly, you can see that this does not have the vertical lines, but as it's such a beautiful rainbow pattern, it doesn't really matter because you know how many rainbows you've cut. But if you do buy rock tape, and this is rock tape, Superdrug sell it, you will find it has the lines. Now, it has the vertical lines, but it doesn't have the horizontal lines like some of the other tapes, which is just a cutting guide, and it helps you cut it in straight lines. Most tapes are 5 millimeters. You can get wider tapes. Highly unlikely you would need a wider tape. And also be very careful of tapes that come in pre-cut strips. It is very, very wasteful and quite expensive. You are always better off buying a roll than pre-cut strips. You can't say that you would be the same size as somebody else or need the same size tape. Now, this is Kinesio Tape's sports tape. It's a very pretty denim blue. What I like best about this tape is it comes in this amazing dispenser pot, but it's no different to normal Kinesio tape. And if I personally want a tougher tape, I will go for rock tape. And the last sort of tape that I want to show you, you will all be aware of zinc oxide tape, that very, very tough tape. do not use it for taping unless you use a barrier tape underneath. And a barrier tape is this softer tape that you put underneath before you use zinc oxide. But there is something called a Luca tape combi pack, and that is a sports tape. It is like a zinc oxide, but it's not quite as tough and sticky, much less vicious. You can get it in white or what they call skin tone, although I think anybody who's got that skin tone is put pretty poorly, but you should use it with the base tape. A lot of sports therapists will use this sort of heavy duty tape without the barrier tape, but do not use that on children and do not use it on sensitive skin because it does not go together. So we've talked about the tapes. Be careful what you use. Be careful what you buy. German tapes are fine, Dutch tapes, UK tapes, Japanese tapes, but beware of cheap tape because they will have cheap glue. Okay, I'm just moving some bits and pieces. So the next thing we need to think about is before you start any taping, and we do this to everybody, seriously, everybody, you should do a tape test. Now, many therapists I know really say it's not necessary. In pediatrics, I have had several children who've been allergic to tapes. We have very little selection where we work, but in my own taping armory, I keep as many tapes as possible. Do a tape test. Basically, what you need to do is stick a piece of tape on, usually the back of a hand. It's sensitive enough. Put it on the back of the hand and leave it there. Now, the minimum you should leave it there is 20 minutes. Some people say it should be 24 hours, but that doesn't work for us as therapists unless you're going to send the person home and check them when they come next time. And for neuromuscular, for us, that doesn't work at all because they won't be coming back for about 6 months. But we always do a tape test. Try the tape that you have bought. In the home situation, you can leave it on for 24 hours. Some children won't let you, they'll rip it off. The next most important thing is how you take it off, because you should never, ever rip tape off. Firstly, if you do a tape test and go whoosh and pull it off quickly, how do you know whether you're allergic to the tape or whether the red mark is from you whooshing it off quickly? So you must always roll it incredibly slowly. It's a bit tedious, particularly if it's been stuck down well, but you should always roll it extremely gently and extremely carefully. Unfortunately, there is no excuse for ripping tape off unless you're definitely not going to put any tape back on again. And as I say, if you rip it off quickly, you will get a red mark where you've taken a bit of skin off. If you are doing repeated taping and you take the tape off and you whoosh it off, you will take a tiny layer of skin with you. So the next tape will take another tiny layer of skin and you can set up a reaction through doing that. So I'm afraid it is tedious, but you really should take care on how you remove it. It may soak off in the bath, but it is waterproof and showerproof. Most good tapes will stay on for a few days. I've had tape on myself for up to a week and it's stuck there. And you don't necessarily want to take it off. I've usually taped myself, obviously, if I've got sprains, strains, or repetitive injury, and it does stay on quite nicely. So never, ever rip the tape off. Always do a tape test with the tape that you bought. If you're allergic to it, or your child's allergic to it, or your partner's allergic to it, get rid of it. So that's the first bit of your kit, is obviously the tape. The next bit of your kit is a good pair of scissors. Most tapers will tell you to get Teflon scissors, because what you will find with normal scissors is you will get some of the glue starting to stick to the scissors. You need to keep them clean. You need to keep making sure those scissors are clean, or buy expensive Teflon scissors and that tape will not stick. So the next part of my kit is this, and that is tea tree oil. I get it from Body Shop, although I think Neil's Yard do it as well, and there are probably plenty of other people who use tea tree oil. This was a trick I was taught by Esther Duroux, who is a brilliant taper. If you can get onto her website and learn taping from Esther. The only problem I have is I can't get the top off this bottle, which is not terribly helpful. There we go. It smells beautiful. It's a little antiseptic. It is oil, but it is wonderful for cleaning old tape, but more so, it's great for sweaty hands and sweaty feet. Now, one of the biggest problems we have is taping over the palm, and there are tapes that go into the palm, but there are several problems with taping the palm and the tips of the fingers. The first one is mess. Unless you are prepared to wear gloves for a lot of activities, taping over the palm is going to get very messy and disgusting. So children who would not like to wear gloves for a lot of activities, taping over the palm is a big problem. Sweaty hands, sweaty feet, tea tree oil. Okay, so it really should be part of your kit if you've got a Sweaty Betty with you. Okay, the next part of my kit, would you believe, is a disposable razor. Obviously, a different razor for every person. Tape does not stick well in hairy places. So if you have hairy teenagers, if you have hairy adults, the back of the neck, you can tape the back of the neck. But if you imagine that if your head drops and you've got tape right up to the place, your hair, particularly with boys or men, come right down the back of your neck, it's not going to be very comfortable when you tip your head down and it's pulling on the little hairs at the back of your neck. So you will need to shave them, or you may need, for an adult, for them to shave themselves if it's their legs, arms, they've got particularly hairy arms or hands, they may not want to shave. Ladies are much more used to the idea of hair removal. Men aren't. Men are a bit wussy about having tape taken off or getting it stuck, and will complain about every little hair that gets caught. So you do need to think about shaving. Now, when it comes to children, we will not shave your child. You will be asked to shave any hairy bits, as I say, particularly the top of the back of the neck in some of the boys, because it really is much more effective without. Now, the tapes, the glue on the tape will stick better with heat. Do not ever put a hairdryer on it because it will glue itself solid. And what you're supposed to do when you have put the tape on is rub it to make heat, to make it stick better. And the only other note of caution is if you are ever having your hamstring taped, and this is for adults rather than children, you should be having your hamstring taped all the way up the back of your butt. There is no point in having your hamstring taped unless it's a discal injury, a knee hamstring injury. But if you have a hamstring problem that goes all the way up, or a sciatic nerve problem that involves your hamstring, be careful of heated car seats, because if you sit for a while on a heated car seat, you may well find that it's stuck for a long time. So heat will make the glue stick better, but do not put a hairdryer on it. Do not, if you are going in the shower and the tape gets wet, put a hairdryer on it. It will dry quite quickly, just with a towel rub. The only other thing you will want when you're taping is to video it, camera it, take pictures so that you know what you've done, or you know what your therapist done, so that you can reproduce it. It's really important that you're doing the same thing, or not doing the same thing if it didn't work. There's no point in doing the same thing if it wasn't useful. So you may well want to tape what you're doing, video what you're doing. Okay, let's have some do's, and then we'll have a look at some don'ts. So the tape test we have discussed. Practice your tape techniques probably on friends. It's a really difficult time to actually be practicing tape techniques. So what I have done I've stuck some on balloons, and that is one place that you could try your taping techniques. And I'll tell you why, because you have to get used to using tape. It's not as though you just open the tape, take the backing paper off and stick it on. There are ways of laying the tape down, and I have found a balloon quite an effective way of practicing taping. If you don't, while we're in lockdown, have any friends, you may not have balloons, but you can practice on your own bits of body, on your legs, you can practice on your arms, but it's not just a case of ripping off the backing paper and sticking it on. We'll go through that. What I have got on here is a strip, a Y-shaped tape, which is very useful for things like tendo Achilles sprains, knee sprains, some hamstring sprains, some shoulder, a lot of shoulder, particularly if you're getting pain here. There's a lot of nice taping you can do with a Y tape around your shoulder. And then we've got an X tape, which just spreads the tape out further over a larger area to capture, if you're trying to re-educate muscle, to enclose more of the muscle. So those are three of the main tapes. There are other tapes, but a balloon is quite a nice place to practice your techniques of laying your strips on and learning to use the tape. There is one other sort of tape. Admittedly, it's pink, and I wouldn't use this one, but it's a nice contrast to a yellow balloon. This is punch tape, P-U-N-C-H, as it punch, because it's got holes punched in it. This is used for swelling. It is only made by Cure Tape. I have it in different colors. I've got orange, I've got black. It works, and I know it works because twice when I have had sprained ankles, it has worked there. And a colleague recently had a very bad bruise following an injury, and we taped it with punch tape, and you could see where it was taped with punch tape, the swelling was much reduced. So this is punch tape. As I say, I wouldn't use the pink, that's why it's here, because it makes a nice contrast. And this is a really good swelling tape. There are many, many ways of doing swelling, but the idea is that you have some sort of mesh that helps the swelling go down. Okay, so if you have a partner or somebody in the house, be careful if it's your granny or your mother who's a little bit older, because remember, they have more fragile skin, so you may not want to treat an older person when you're just practicing. The most important thing is to know what you're trying to achieve, because you won't get it right unless you think about the mechanics of what you're trying to achieve. If you want to hold an ankle, you've got to think, what position do I want to hold that ankle? What am I trying to achieve? Am I trying to achieve the heel to come in? Am I trying to achieve more stability? Am I trying to achieve better dorsiflexion? That's toes up. So think first before you put any tape on, what do I want from this tape? Okay, this is your do's. The last do, of course, was to remove the tape slowly. There are quite a lot of don'ts. Where have my don'ts gone? Okay, we need some don'ts. Don't tape over broken skin. That's a really important one. We don't want to tape over open wounds, open injuries, scratches. I've been out in the garden today trying to battle the blackberries. Don't tape over the carotid artery. You know, this idea when you feel a pulse, is this artery here? If you put it on too tight, then you can cause fainting and lightheadedness. There are people who will tape there. They're very experienced tapers. They know what they're doing. I won't do it. I will tape the back of the neck. I'll tape the trapezius muscle, but I will avoid the carotid artery. The other thing is, if you are pregnant, do not tape your belly. It is not recommended that you tape your belly. Okay, so those are some of the major don'ts. As I say, don't use too much heat when you're trying to stick your tapes. Okay, let's have a think about cutting the tapes. Is it as basic as it sounds? Now you will have noticed, if I go back to my balloon, that all my taping has rounded edges. And when you learn taping, you learn to do that automatically with almost every single tape. You cut off the edges. And the reason that you do that is it's much harder for it to peel off. If you have a little pointy corner, it'll get stuck on your clothes, get stuck on your socks, and it's much more likely to come away quickly if you don't round your corners. So when you have a piece of tape, you want to cut a strip. You cut your strip. I'm not taking an awful lot of notice of what's going on at the back of the tape. And you make a rounded edge on your piece of tape, and it will stay on better. Undoubtedly stays on better than those pointy corners. So get used to cutting and rounding your tape. Now I'm going to do 2 strips because I want to show you the 2 different ways of taping. I think my scissors need a good clean, to be honest. Okay. The next thing you need to know about the tape is you should not be touching the sticky bit. And that is one of the hardest things to learn, is to actually learn to tape without you touching the sticky bit. Let's have another balloon. Okay, so when there are 2 ways of tearing tape, you can either tear it at an end, take off that end, lay it down, and then stick the other bit, or you can tear it in the middle and open it from the middle. These are different taping techniques. Taping in strips and laying it in a strip is much more a movement tape. Taping it, tearing it in the middle and laying it on is much more a hold support type strip. So when you are trying to learn, and again, it's quite an expensive thing to do. You'll think, I've bought this really expensive tape. I don't want to keep using it to practice. You need to practice. So what you do is you take off the end. This is called the anchor. That part is not stretched. It is laid on the skin with no stretch. Then peel it back and work from here. Now at this point I want to decide how much I'm going to stretch that tape. The more I stretch, it's not necessarily, you can see the stretch in the tape. If you stretch it too much, it won't recoil. That's not helpful. The normal stretch that you want to put on is roughly 10 to 20%. So if you start off with a 10 centimeter strip, it should end up between 11 and 12 centimeters long. But remember, you have to leave an anchor at the other side. Okay, so when you're laying your strip, you do your bit of stretch, you lay it down, and then you do your other anchor at the other end, and that's where you have your strip, and that's how you lay it down. I did not touch the glue at all. Now, with the other strip, go on, come in. I'm going to tear it in the middle. I peel back the tape. I lay it down, center. I put my stretch on, however much stretch I want on the tape. And then I lay my anchors down at the end. The anchors at the end have no stretch. And that's laying it on from the middle. You need to practice. It is not easy not to touch the glue, but again, if you don't touch the glue, it will stick a lot better. If you find that you really finding that quite difficult, then clean your own hands with the tea tree oil first, so that when you touch the tape, it doesn't lose its stick, because your hands will be free of any mess, any sweat, any body fluid. So those are the 2 ways, tearing at the end and strip, and tearing from the middle and laying it outwards. It takes practice. It takes practice. I was very lucky that I used to practice on friends, particularly anybody who would let me. My netball team were very patient, and I taped a lot of them as well. So it's really a good thing to practice. Now, I have to say I have, with bribery and corruption, borrowed a hand. Doesn't matter which hand, but bring the chair. I want to show you this tape particularly because it is a very, very successful tape in SMA. What we tend to find in SMA is that even from tiny infants, 1, 2 or more fingers do not want to extend. And for that, we use a fan tape. It starts off up the wrist. Starts off up the wrist. Yes, I know it's a bit of a hairy wrist. I'm not going to shave it because it's not staying on long. This is just to show you what I'm doing. It starts off down the wrist, comes across the hand, and then goes across the fingers. Now, you can do the thumb as well if the thumb's involved. It's a fairly complex tape. You need to measure how long you think you're going to need, remembering that you need stretch as well. So you don't want it completely the length. Okay, so this is quite a complex tape to cut. So if I'm not going to do the thumb, obviously I want it in full. So I have to think about where my fingers start and finish. So this is going to be my anchor across the wrist. Then I have my hand section, and then I have my finger section. Okay, so 4 fingers. So I cut it into 4 equal strips. Cutting down in 4 equal strips. It would be 5 if you were going to include the thumb. Now, obviously, for very small children, you may cut a strip because this is a young adult. I'm using the whole width. If it was a child, you may have started with a strip. Again, you have to practice getting nice straight lines. And again, it does help to have the horizontal lines on the back of the tape, but they're not equally spaced. You get used to cutting nice straight strips. Now, each one of those strips then has to have a rounded edge. So that's another bit of the taping that you need to think about. So each strip has to have a rounded edge. And then you need to think about tearing it. What you need to do is tear the tape at the end of every one of those strips so that you can lay each finger on separately. So there is some work at practicing, and make sure you separated it properly so it's easy to take off. And at that point, you are going to be laying it on the hand. So you start with your anchor section. You anchor it across the back of the wrist. You take it across the back of the hand, lay it down. You can see how now it works with my torn strips here. They've still got tape on, backing tape. So then I do 1 finger at a time. And I take 1 strip up each finger. It may come right over the nail. I can trim that later. Each finger gets a strip. Each finger gets a strip. And it's a very, very effective tape for children who find it difficult to extend their fingers. A really nice, effective tape. This little finger's a bit long, as we would expect, as the little finger's smaller. It's all right. I'm not in the habit of removing bits of body. I'm quite squeamish, so I don't like blood. And that's quite a nice tape for fingers. It does take some practice, but very, very effective. Thank you for the use of your hand. Okay. I know from something I was told that people are very interested in taping feet. So I have my friend here. Who is going to come and share her foot. The most important thing about taping feet and ankles is to think. You need to think 3 parts of the foot. This is not about taping one piece of foot. You can tape one piece of foot for plantar fasciitis. I don't. I always like a midfoot tape. But when you are taping, you have a heel and an ankle separately. Your foot goes up and down and in and out in 2 different joints. Your ankle joint sits above the joint that wiggles your heel in and out. They are 2 separate joints and we have to think about them separately. The midfoot, where the arch should be, it's not always there. And that is an important thing to consider. And then the forefoot, is it twisting in? Is it twisting out? And if it is, how are we going to manage it? Or can we manage the forefoot in the same tape as the midfoot? In some cases, a lot of cases, you usually need to actually stretch this section of the foot as well. It would be very rare that you have to stretch this section. It would usually be a bit. Again, you can treat hallux valgus, bunions, but that's not something we'll necessarily talk about unless people have any questions. Andy, any questions?
Yes, we have
yes,
some
no.
questions coming in.
No.
So,
yeah. Stop for some questions?
You ready for questions now?
Yes, I'm happy for questions.
Okie doke. Right, first one. Not sure whether this is going to be something you're going to be able to help with, but my daughter is type 3, has started having hiccups during after eating meals. She's had 4 loading doses of Spinraza and is on Ventolin syrup. Any suggestions?
For hiccups, I'm not sure if taping works. I honestly am not sure. Hiccups are spasms of the diaphragm. Why she would be having spasms, I don't know. It may be you need a respiratory physio or a speech and language therapist to find out why they're getting hiccups, or asking a doctor.
Right, next question, which is more related to tape. How long should they be used for the body to make them work and stretch? I heard a few times from 12 to 48 hours or several days. I guess I mean, how long can you leave them on?
You can leave tape on as long as it stays on. That's the first thing. Some people will find tape will fall off after a couple of days. It may not even stay on a day. There are children who will rip it off. The hand tape that I've just shown you, not all children like it. I find that the people who leave it on are the older adolescents and young adults who really find it helpful. It works beautifully with children. I've really seen some dramatic improvement in finger opening with the taping, but some of the children don't like the sensation, which is unfortunate. It really does work, but it's what happens with the tape. You need to be careful when you're taping feet. Socks, you've got to make sure the tape is well stuck before you start putting socks on. Socks can get the tape off. Shoes can get the tape off. Some people have tougher skin, and as I say, with me, I'd had tape on for 5 or 6 days and left it on. Haven't felt the need to take it off because felt it was still working. Whereas in some situations, you may feel it's not doing the job. My honest feeling is I've heard of people saying, oh, take it off after 2 days. I think if you can leave it on for 4 or 5 days, if it's working, then leave it on. But again, it will depend on whether it starts dropping off. You can trim the tape. If it starts curling up at the edges, you can trim it and leave it on if it will stay. Occasionally, you can put an anchor tape on. So it's starting to curl up. I'll just show you because Rosie's got a knee tape on. If this was beginning to curl up at the bottom, I could put another piece of tape across it to hold it down. So that might be an effective solution to keep it on for another couple of days.
Okay, next question. Are there certain tapes for different ages?
No, there are no different tapes for different ages, but if you have somebody who's got thin skin like an older person, or very sensitive skin who's allergic to a lot of things, as I say, like glue, for an older person, and I'm talking about probably 80 plus, or somebody with thin skin, maybe because they've got poor circulation, I would use a hypoallergenic tape, a gentle tape. I certainly wouldn't go for even rock tape or any of the sports tapes, because they are tougher tapes. There's nothing to do with age. The only other thing beware of, there are veterinary tapes for animals which have very, very powerful glue. You don't want veterinary tapes. So don't think that you can buy any old tape and it'll work, even if somebody's having a sale. But there are quite a lot of tapes on the market. Do be careful. As I say, an extra strong glue is really not necessary unless you're a sports person. And you really need to go and play a rugby match or a football match with your tape on.
Excellent. We've got some comments coming in. Great work, Marion. Your dedication is awesome. We love you, Marion. Fifi sends her love, Marion.
Hi, Fifi.
You can tell this Sunday evening slot is quite popular. Right. Next question. Can you stretch the knees a little bit while applying tape?
The question is what you're trying to achieve. If you're trying to improve contractures, no, it's going to be quite uncomfortable. It does not work on contractures. It works on reduced movement. You can do muscle re-education. So if you're trying to get the knee to work, so if you've stretched a knee and you've got improved range of movement, you've done serial casting, or you've worked really hard at the stretching, or you've religiously used your splints, and you find that you've improved the movement, but whoever it is cannot actively move, you can use, and this is the sort of why tape we use for knees, to try and activate the quadriceps muscle, quite effective. So yes, you can use it to help learn to maintain that range of movement, help to activate the muscles, but you need to do it with exercise. Tape by itself will not cure anything. It's got to, again, like with most of the things we talk about, it needs, oh, hello, she's very sweet, isn't she? It needs to be active. It really does need to be active. Unless you're looking at pain or swelling or holding joints, then taping is an active thing. You want the movement to work with the tape, or the tape to work with the movement. It won't cure contractures. We can use it in spines. We can use it in children who are asymmetrical. I'm not advocating that this is going to cure any scoliosis. But if you've got a child who has got reduced movement and you're trying to stimulate that movement, you could try tape. But don't be surprised if you don't get good results, because the spine is a very long thing in relation to how you're going to use the tape. And there are lots of different muscles up and down the spine. It's not just one muscle. The spine is the spinal muscle. The muscles, they're called erector spinae, basically straightening the spine. There's lots of little ones. It's not one great big muscle. The biggest and most important muscle, the trapezius muscle, which is this great big one that goes across the shoulders and down the shoulder blades, that is very good for taping. If you're stuck up here and you're finding it's getting uncomfortable, we can work on getting those shoulders down. But it's all part of active movement. You can't cure contractures with tape. It's all about re-education, stability, trying to improve movement. We can't make movement that's not there.
Okay, which might move us on to the next question, which is, I'm interested in knowing the correct way to improve contractures in the foot and knee with taping.
Okay, well, we're going to talk about the foot in a minute, so we'll get on to that. It's not about improving contractures. Again, as I say, it's about improving the movement, stimulating the opposite movement, and we'll talk about that as well when we get on to the foot.
Another question, interesting one. What about taping on the face? Upper lip, for example, does that help speech?
Interesting, because one of the worst tapes I ever saw was on a baby in an East European country. it was a baby who was about 8-9 weeks old, who had tape on his upper lip. Now, the problem was he didn't have good lip closure because the lower jaw was behind the upper jaw. Putting tape on here is not going to give you better lip closure. In theory, you would tape all round, but a lot of facial tapes are very unpleasant. Obviously, with a baby who's drooling or has secretions, they get nasty very quickly. So I'm not convinced that you can do an awful lot of taping. This will not necessarily improve speech, because speech is not just about your facial muscles. Speech is also about breath control and what's going on in your voice box. So the facial muscles are not the biggest part of speech. Obviously, there are things with chewing, there are swallowing. Now, again, Esther has done a lot of work on swallowing with speech therapists, and the most important place is taping under here for swallowing, but you need to read her work about how she uses taping for swallowing to improve swallowing. I have done it when I was being taught by her, but I've never really used it. But there is stuff on swallowing. But actually, to improve facial muscles, it's not impossible, but it would be much more in a very weak situation where you're trying to, again, stimulate movement. And stimulating movement with the face will not necessarily improve speech or swallowing. And it's like facial exercises. There is no evidence that facial exercises work dramatically in speech and swallowing.
Okay, great, thank you. Another question. Should there be a break between one taping and then applying another tape?
Not necessarily. It depends on whether it's working or not working, whether it was working but it's stopped working, and also whether there's a skin reaction. If you have a skin reaction, you need to stop. End of. You stop. Now, you can start again when the skin has healed, but you must not tape over skin where there's been a skin reaction until it's completely gone. You may want to think what caused the reaction. Was it allergy to the tape? You're going to have to try a different tape. Interesting. Tape that is on too tight will cause a bad skin reaction. I had that happen to me the last taping course I did. The girl that taped across my hand here taped me too tight, and it really did cause quite a lot of discomfort. When we took the tape off, there was quite a red mark, and it really wasn't on for very long. So taping too tight can cause a problem with skin. So if you have a skin reaction, the tape needs to come off, the skin needs to heal, you can try again. If you find you are getting no result, or the result isn't helping, you may want to stop, have a break and start again. But there is no reason why you cannot tape one tape after another. Interestingly, one of the things that we use a lot of our taping for is feet when we are serially casting. And we use 3 serial casts and we use 3 lots of tape. We are very careful how we take it off. We are very careful about reaction. But the most important thing when we're serially casting is to make sure that the heel is right in the middle. And sometimes we need to tape that heel in to hold it in the middle, because that will give us a better stretch on the Achilles tendon. So we will tape it, and we will do 3 tapes in a row, and those plasters are on for anything between 10 days and 2 weeks. So yes, you can do continuous taping, but I certainly wouldn't tape for more than 4 weeks in a row.
Thank you.
I think the skin's going to go a bit manky if you tape for too long. You know what it's like when you're taking the elastoplast off. I really don't think the skin would be very nice after 4 weeks.
Very true. Right, next question. We have one, and I'm not entirely sure how to pronounce this, but I'll have a go. Can you use taping for, is it lymphoma on legs?
Oh, lymphedema, for swelling. There are lymphedema tapes. There are most definitely people who are expert at lymphedema. It is part of swelling, but you can't just use a swelling tape for lymphedema, because there are 2 different things we're talking about here. There is actual lymphedema, which is a problem. And lymphedema, which is swelling caused by some sort of blockage of the lymph system, is very different from swelling. So that a lot of people with SMA find they get swollen legs, swollen feet, postural, partly due to contractures, partly due to having your feet down all the time. And again, you can use tape, but you have to use tape in conjunction with other things. The tape will help the swelling, but when you take the tape off, we're back to the same situation, that you're not going to reduce it over a long period of time. What you need to think of is how you manage that swelling long term. But there are certainly, if the swelling is a big problem and you know a tape person, the girl that taught me on my kinesio tape did a lot of lymphedema tape. That's where she started, in lymphedema. And there's some incredible looking tapes for use in lymphedema, but it is quite a complex subject. You would need to get some good advice on lymphedema taping.
Okay, another question on contractures. Just to clarify, taping works on contractures but not fixed contractures. If there is still movement, the tape will still work, will it?
Yes. If you're trying to get movement, active movement, and you're working with stretching and you're working with active stretching, then yes, you can use it. But if the contracture is old, if the contracture is severe, it will not help the contracture without the stretching and the active movement as well. So it's a combination thing. It's using the tape in combination, but it's not my first thought of contracture management. I wouldn't go to taping. I'd much rather go to splinting. It's a much more useful thing to do. Taping I would use in very rare cases for contracture management.
Okay, thank you. And there's a couple of people asking for more details about Esther. You've mentioned Esther a couple of times.
DURUE, it's D-U-R-U-E, 2 words. Esther DURUE.
And has she got a website or?
She has. You will find her. She's very famous in the pediatric taping world.
Great. Okay. I think that's all the questions for now.
Okay, so there's 2 things we really want to talk about, and the first one is feet. What I need to know, because I know there's lots of parents out there, when I say what I need to know is the heel twisting in or twisting out? Because that is really important. And the other thing I need to know, if the foot is twisting in, I do not just get the tape and pull it out, because it teaches nothing, and actually the reaction is to fight against the tape and come back. So I've got a heel that's twisting inwards and a foot that's turning in, and I have to think, how do I want to make this work? I want to turn the heel out. I want the foot to think, I need to be out here. How am I going to do that? And what I do is I bring the foot out, or bring the foot into a nice neutral position, and I work from this side. So the foot's twisting in. I don't just bring the tape down the inside of the leg, pull as hard as I can and twist that foot outwards. I have to think, I want to teach this heel to come outwards. So I bring the tape down this side of the leg, some stretch over the heel, and a little bit up the other side. And I'm going to do it and show you. So I start on this side, the outside of the leg. I put my anchor down. I take my tape. I'll tell you what I'm going to do. It's getting a bit dark. I'm just going to put a light on. That's better. Okay, so I've got my tape coming down the outside of the leg. Here, under the heel with a bit of stretch. I've got the heel in a nice midline position and up the other side. And my thinking is, I have brought the heel into this middle position. As the heel wants to twist back inwards, the tape is saying, oh, come back this way. So as the foot wants to twist back inwards, you can feel the tape saying, no, 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 I want to be here. So the foot is getting that stimulation to move back into that nice neutral position. So you have to think a little bit backwards. It's not just a case of putting the tape on down this side and pulling the heel out. It's a case of, what am I trying to achieve? How am I going to teach the heel to do that? Now that's what I would do. But what I would also very likely do, because I'm trying to produce a nice shaped foot, is do a midfoot tape as well. Because the foot is not just about what's going on in one part. And if I'm trying to control a heel, I'm trying to control the arch as well. So I want support under the middle of the foot. I've got support over the heel. And I would do a heel tape, as a midfoot tape as well. And I would go in the same direction. And I would support under the arch, make a nice arch, actually make the arch with my finger and support the arch as well. And those are very, very comfortable tapes. A lot of people say they really feel the support from the midfoot tape, supporting that big arch under the foot. It's often flattened when your foot twists inwards. It can be curled, can curl up from the big toe, and that midfoot tape is a really important part of the tape. Now it shouldn't, if you've done it properly, need any anchor tapes. Very important, something I've seen a lot of and seen recently, is taping right across the joint or round the foot. And when I was doing the London Marathon last year, I had a young policeman who came in with quite a painful foot, and a sports taper had taped him all the way round. There was no gap in the tape, and when there was no gap, his foot had swollen below the level of the tape. Be very, very careful when taping round feet and ankles that you leave a gap. Always leave a gap at the front of the foot, somehow, some way, to stop the foot from swelling. Never ever tape round and round, because you will get swelling. So it's a note of caution. Don't tape all the way round. Don't tape lots of tapes up and round and cross over the front of the leg. A lot of our midfoot tapes will cross across the front of the foot, but what I need to do is, when I have a tape here and I'm bringing this tape across, and as I say, very often I'll come all the way up the front, I must make sure I don't tape that one. Now the tape looks quite flimsy, particularly if you're doing a big adult and you think, oh, one piece of tape won't be enough, I'll tape a few pieces of tape one over the other. Tape does not like sticking to tape. If you are trying to anchor it, you must make sure there's enough skin under the tape. But you can't just keep taping over tape over tape. A lot of the pictures you will see on the internet, tapes tape over tape and tape up here and tape around here. And there are people who are almost covered. I mean, one of my favorite pictures is the picture of a woman who has so much tape on that she's going to do some sort of river swim or open water swim, and it looks as though the main reason she had it on was to save herself buying a wetsuit, to be honest. Really bad taping. So be careful of going all the way around the foot or taping lots of tape over more tape, because it won't be effective and the result won't be as good. There are a lot of amazing pictures on the internet. Okay. How long should the tape be? How far up the leg? How far up the other side? Again, it depends what you want to achieve. You don't want to go all the way up the leg, but it's got to be far enough up to have your anchor, no stretch on your anchor, bring it down and round. So you've got to have enough tape to go round. You want it to come high enough up this tape so that your foot is getting the stimulation. You need this far enough round to come onto the front of the foot. So again, it might be practice. You may not get it right. When I first started, there were times I didn't get it right. I taped a friend's leg and it was quite amazing. It suddenly started jumping. He had this twitch, and I'd obviously caught a nerve with the tape, and it was quite dramatic to see this negative result, and obviously I had to take it off and move it. And sometimes we actually don't get the muscle we want to get, and you have to try again. Now what's interesting, and this is another one I want to talk to you about, and that's wrist tapes. Again, it's the same principle as the foot. There is no point if I tend to hold my wrist down here like this, just getting the tape, sticking it on this end and pulling it so that it pulls my wrist up, because I'll just fight against it. And you can cause shearing so that you do get skin reactions. If I want to keep my wrist up, and I don't want to keep it all the way up, that's not comfortable, when you grip, if you put your hand flat and grip, you will see that your wrist automatically comes up. That's about how high you ever want to bring a wrist. You don't want to bring it higher than a normal grip position. So what are you talking about? It's about 30 to 40 degrees. That's it, no higher. That is not comfortable. So we're talking about 30 to 40 degrees. Again, I bring the wrist up. I start from the arm and I bring the tape up to here. I can bring it over the knuckles. The usual is to bring it up to about here. I can split the tape so that I'm doing like a fan, like I did on the hand, so that it comes out across the back of the hand. But I start from here. I bring the wrist up. I tape in that position so that as my hand drops, the tape's saying, no, come back. And that's the sensation the tape is giving you. Come back. It's very effective when it's done properly. As I say, you do not start at the hand and just hoik it down, and you don't pull up and just bring it up too high, because it won't be comfortable. So you need to think about what you're trying to achieve. So those are correction tapes. Those are trying to get the body, the muscles to correct themselves. Questions before we go on to sprains and things?
You want some more questions, Jess?
Yes, please, because we've got a couple more things to talk about.
Okay, no worries. So is there anything that works alongside taping for foot other than stretching and AFO?
Depends what you would say about working. We can use it to stimulate the muscle at the front, the one that pulls the toes up. So if you do get some increased range, you want to get the foot up. Now, when you want to do the front of the foot, you have two lots of muscles. In fact, one of the muscles comes underneath the foot, but you need to make sure you have a big muscle that goes to your big toe. Again, you probably want a fan tape to make sure that you're bringing all those little muscles into play. This is the biggest one, tibialis anterior, often known by physiotherapists as tib ant, but there are other toe and foot dorsiflexors, that's toes up. And again, if you're trying to stimulate these to work, I would use a fan tape. So I would start up here, down the leg, and then spread it out across the front of the foot. At most, I would use a Y down to the middle, and then one branch here and one branch there.
Okay.
But in terms of taping, splinting, exercise is still one of the most effective tools we have. Sorry.
Can tape be used under orthotics?
Yes, definitely. But you can't do it forever. I've known people whose feet have been twisting inside their AFO, often turning inwards, rarely turning out. Often the heel turns in, as we talked about. You can use that taping inside the orthosis. But what you have to think is the orthosis doing the right job? Is the strap in over the ankle doing the right job? One of the problems with orthoses, and I did have one in here. Let me think about where it's got to. One of the troubles with orthoses is, let me get it because it is here. Okay, sorry, I'm back. Right, you've got your orthosis. If you have a plain ankle strap that just goes across the top, very often it will do nothing for your twisting here. And that is the big problem. These bog standard straight straps do not correct a twisting heel. So if your heel is twisting inside there, yes, that's a good reason for using the tape. But ideally, you would want a better strap. And the way to get a better strap is to make sure that the strap is correcting the heel. And the way to do that is to use a strap that comes through. Now you can use what is known as a Y strap, which comes from above and below, not just straight across the joint. And then it comes and it fits like the Y tape, fits through a slot. So it's lower down, and then that comes from inside, pulls round, and that will help to bring the foot into a better position. So one of the big problems with a twisting foot inside an AFO are these bog standard ankle straps that do not correct it. So the tape is having the same effect, but better that you're using the tape with a good ankle strap, a Y strap, that it comes through a slot, not just ties on the top, because if you can imagine, that is not going to stop an ankle twisting inside there. And that's one of the problems with using these bog standard straps. They're great if you're not twisting. They don't work if you are. Okay.
Next question. What's the best way to get tape off?
Just roll it. Or you can use tape remover if you have tape remover. Some people have tape remover. There's something that Lakeland do, sticky stuff remover, but just rolling it will bring it off. You can soak it, as I say, soak it in a bath. Wetting it might bring it off a bit quicker, but just slowly is the key. Do not rip it off. But if you have tape remover, it will help. Tea tree oil, again, can help. And if you leave any of the sticky tape behind because it's been on for a little while, any of the glue on, then tea tree oil is another good way of getting the mess off. But you can use sticky stuff remover. As I say, Lakeland do one. It does smell quite heavily orangey, but it is very good stuff for sticky removal.
So the other request we've had is, would you be able to provide, and maybe you could either email me or Lucy, details of good tapes that should be used?
Yes.
And then we can
do a list of nice tapes. I'll make up a list of nice tapes.
Brilliant, thank you. I think that's all the questions at the moment.
Okay, so there's a couple of other things we wanted to talk about in terms of using tapes. So let me just have a look. Next. Okay, we can use tape on necks. As I say, you need to be careful about hairlines. This is just a bit of dolly. You really don't want a great big piece in the middle here because that's mostly bone. You are looking at taping the trapezius muscle, but most of that is across the top of the shoulder here. So that people who are stuck there, do you just tape from the top and pull down? Very often the answer is no. Again, you're working backwards. So you stretch the shoulder down, not too far, just gently stretch it down. Take the tape up here. And again, as the shoulder pulls up into this position, the tape says, no, come down again. Your carotid's here, you've got plenty of room at the back, the muscle is there, it's this sticky out one here, you can tape that. And a lot of people, iPads, iPhones, all this pain down here, lot of parents have got pain down here. So really nice tape for trying to reduce the pain here. Shoulders. Again, shoulder pain. Very often where you will find shoulder pain is just around this point of your muscle called deltoid. This is the deltoid muscle. Some people like to tape across, tape over the top, but a Y tape, anchor here, strip round this side, strip round that side to support that may be enough. You may have a tape this way as well. But for deltoid muscle, with that pain that you've got in here, very often that Y tape is enough. Shoulder blades. It really depends on what you're trying to achieve. You can improve posture with tape across the shoulder blades. It was the X tape very often works, but be careful with using that tape across the shoulder blade, that as the shoulder blade moves, you're not causing shearing. So X tape is a nice one for shoulder blades. Shoulder blades are quite big. So you will get the muscles, but be careful how you do it. You need to tape across. What you need to try and do is not come right across the spine when you're taping the shoulder, but a nice X tape is a good shoulder one to try and bring the shoulders back if you're constantly hunched and getting pain from hunching. So you can work on that. You may want to do it one arm at a time, but beware of shoulder blades. Because the shoulder blade is very mobile, you don't want to cause shearing. If you have sticky out shoulder blades, what we call winging scapulae, sticky out shoulder blades is weakness of the muscles around and particularly under the shoulder blades. You cannot stop that happening with tape. Dislocating kneecaps, very rare, but you will not stop it with tape. Not if it's dislocating quite badly. Type 3s very often have knock knees, and we've talked about these knock knees before. That's when your knees tend to do that sort of thing. So your knees are going together and your feet are going outwards. Now again, I went to a conference and saw lots and lots of little type 3s with tape here. Total and utter waste of time having tape here, because that's not the problem. The problem is weakness in the butt. So actually you want to correct this, you have to work up here. It wouldn't be impossible to tape the butt, but it's not really that easy to do and not that effective. But you are not going to stop knock knees by taping the knees. Okay, another thing that's very common in type 3 is what we call hyperextension. When this is forwards and your knees over straighten, so that when you stand, your knee joints look as though they're poking backwards. That is the back. And again, I have seen people taped with this hyperextension at the back of the knee, which is just pulling them more into hyperextension. The nicest tape for knee hyperextension is to work on these quadriceps muscles, the muscles at the front of your thigh. And again, Y tapes are the nicest tape for that. And that is your Y tape. Now, another good use of taping is for muscle that has got weak after a fracture. When you have a fracture and you have been immobilized, be it an arm, a leg, anywhere in shoulder, and you have been immobilized for whatever reason, it doesn't even have to be a fracture, it could be a sprain, a bad sprain, or an injury, then using tape is a very, very effective way of gaining range and muscle back after that weakness post-fracture, and that is or injury, and that is a really nice use of tape. Okay, it looks like we may be running out of time, so let's have some last questions, Andy.
No problem. So we have you any advice for legs bowing outwards?
Very unusual to bow outwards in SMA, and the question then is it hips, is it knees, or is it tibial torsion? And that's between the knees and the feet. Tibial torsion may not be uncommon, but that is usually a problem of alignment between knee and ankle, and again, tape wouldn't prevent that. That is something much more structural than tape would prevent. Not common, but it's much more structural. You could work on the ankle and knee alignment with tape, but whether it will work long term, I don't know.
Okay, and another question. Hang
on 1 second, sorry Andy. The other thing about bowing outwards, you may be talking about the way the legs roll out. that tendency of a lot of the children and probably some of the adults as well to just roll out. That's maybe what you mean by bowing of the legs. That's not strictly bowing of the legs. That's external rotation, usually caused by ITB tightness. You won't cure that, but again, you can use spiral tapes to try and teach the kids to bring their legs in. Probably won't make a lot of difference on an adult, but a spiral tape could help to internally rotate the legs. But again, you have to think where you're starting, where you're ending, and what you're trying to achieve. Sorry, it was just occurred to me that they might mean that external rotation with bowing.
No worries. Another question, can tape help for kyphosis?
That really depends on what age we're talking about. Little children have kyphosis, and again, why do we get kyphosis in the smallest of the children, particularly some of the little type 1s? Some of the kids who are on Spinraza and starting to stick are very kyphotic, and actually, why do they get kyphotic? And the reason they get kyphotic is because they're counterbalancing. So what you have is the hamstrings are pulling the pelvis backwards, and the children are reacting by counterbalancing forwards. So they counterbalance into that position, and that causes this kyphosis. So actually strapping the here will not necessarily improve kyphosis. What you have to do is improve the sitting position, whether you can stimulate extension of the trunk, but you've got to again do it in combination. You could possibly tape down the trunk, think about what you're trying to achieve, trying to get those shoulders back, but you have to take the pressure off the hamstrings by getting the child off the floor, getting that young person off.
The age is 4.5, Marion.
Yeah, you could stimulate extension of the trunk and extension of the pelvis, but you must take that pressure off hamstring that's pulling the pelvis round, so that if the child spends a lot of time on the floor, they will be kyphotic. Yes, I think it could be effective if done properly, in the right position, with the child sitting, because I have worked quite a lot recently on kyphotic position, and the children can be stimulated into coming into more extension. So you could tape that, but you need to do that with sitting position. It's so important to take the stretch off hamstring in that.
And the last question, I know you talked about this earlier on in the video, and obviously people can go back and watch the video when it's on the website tomorrow, but can you just explain how tape can help with swallowing? I
am not 100% sure, because this was done with speech therapists with Esther. What you're trying to stimulate is when you swallow, you can feel something happening under here, and that's where they're trying to actually get right under the tongue and improve the swallow under here. And you can stick your fingers underneath and feel how it actually makes you want to swallow, and that's where the tape works for swallowing. But I am not an expert in taping for swallowing. As I say, if you look at Esther's website, she has done a lot of work with speech therapists on swallowing, but it's right under here that you're looking at taping, and you can actually feel it. If you stick your finger up there, it does make you want to swallow.
Brilliant, thank you. Really popular night tonight. It's been very busy.
Mm-hmm. Good. So if there's questions, Lucy can forward them on to me. I will make a list of tapes. I won't say the good and the bad. I will just say which are probably more effective in which situation. But, you know, people can find tapes all over the place. A lot of the tapes that you will see on the internet are directed at sports injuries and sports problems. That we haven't really touched on the sports taping at all. The sprained ankle taping is very effective. We could possibly look at doing a video of taping an ankle for sports taping, or possibly we have talked about making some videos generally, so it's something that possibly we need to talk about with Treat SMA to make some videos available.
Brilliant. All right, well, thank you very much, Marion, again, and
no,
I'll see you in a couple of weeks' time.
You will indeed. We're going to be talking TheraBand. The TheraBand, the stretchy band exercises, all ages, all power, parents as well, carers as well, getting that band out. You could try Nicker Elastic, probably not quite as effective if you don't have band. Need to be careful with the weights. We're talking TheraBand next time.
Brilliant. Thank you, Marion. Have a good night.
Thanks a lot. Night.